Hey there, don't treat another patient face down until you watch this video. In this episode, I will go over the electrophysiology of the body and why you never want to treat a patient in a prone position. This enables you to obtain better treatment results simply by changing the position in which you treat them. My name is Dr. Jeremy, and I help acupuncturists like you create breakthrough patient results with the world's most cutting-edge electro acupuncture techniques. Now, if you're not already subscribed, go ahead and click the subscribe button now. This way, you can receive a notification each time I release a new training episode. I give away a free downloadable training resource along with each video and blog. And for this episode, it's called Guide to Using the Astronaut and Lateral Recumbent Positions in Electro Acupuncture. So don't forget to download this. It's below the video or in the details section. This can simplify your life and practice. Without further ado, let's jump in.
Now, this slide has two different principles. Never treat in prone position, face down. I know a lot of you at home, you treat your patients in face down, and a certain percentage of them can't even get off the table because their low back pain increased, or their headache increased, or something increased related to the sympathetic system. And there's good research on this, and I've referenced some of it towards the end of this PDF. But just by putting a patient face down, a certain percentage of those patients will increase sympathetic dominance, and that goes against our treatment, right? We're trying to get them into parasympathetic rest and recovery mode. It puts more pressure on the low back, so don't do it. This is my recommendation, lateral recumbent. Now, we have a couple modifications of lateral recumbent because I'm used to treating geriatrics, and she's like super healthy and young, so easy, 2 pillows, right? But I brought 6 pillows in case I'm going to show you how you can do a modified lateral recumbent. So she's like pretty much lateral recumbent, right? But what still works is a 45-degree diagonal halfway between prone and lateral recumbent. That still works, and it's not going to trigger the prone reaction. And you just do that with a bunch more pillows, basically. That's number one. Number two, this system that you're learning this weekend is lateral recumbent because we're doing spinal brackets, right? Well, tomorrow in the afternoon, I'm going to teach you spinal bracketing on the ear because the same exact thing exists on the ear. And it exists outside of a neural connection. It exists in some sort of quantum connection where if you measure a deficiency at T1, you can come to T1 on the ear and measure that same deficiency, and it should be the exact same measurement number. If you add electricity to this deficiency at T1, you can measure that it's adding electricity to the deficiency at T1 on the body. So there's some connection, I don't know what it is, but it's outside the nervous system. There is also a nervous system connection, right? The vagus nerve goes to the contrafloor, but we'll get into that. But there is a connection outside of the nervous system between the ear and the spine, or the ear and the body. What's the point of lateral recumbent, or what's the point of this astronaut position? This is the best position for low back pain, no matter how severe. You want one pillow under the head, and you want a 90-degree here and a 90-degree here. If you're going to treat face up, like if you're going to do an ear spinal bracket, you want 90 degrees here, 90 degrees here. How does that work? Well, I put like 5 or 6 pillows under here, just regular pillows from Walmart. Get them comfortable. Or you can get wedge, special square pillows if you don't want to use a bunch of real pillows. This is making sense. So 2 things about this slide. One is this is the best position for a low back patient. It should reduce the pain right away and be a pretty comfortable position for the patient to stay in. Now, excruciating low back patient, I get them in this position and I treat them for 20 minutes, but if they were so severe, but now they're not severe, I end the treatment, but I just leave them there for as long as they want. Stay in that position for as long as the pain is gone, because the longer amount of time you can keep them pain-free means the longer amount of time the terrain has in this parasympathetic healing mode to clean up. The immune system needs to clean up the inflammation, so on and so forth. The stem cells need to come in there and replenish the tissues. Does that make sense? But no more prone, y'all. I'm going to surprise check some of you, your clinics next week. I'm going to show up. If I see a patient in prone, then you owe me a fee.
So what did you think? Feel free to place your comments or questions below. Now remember, I created this great downloadable resource. The link will be in the description area. Be sure to grab that. Now, I hope you enjoyed this episode. If you did, click the like button, and if you have any colleagues that would benefit from this information, feel free to share the link with them. And for further information regarding my classes, you can visit electroacupunctureinstitute.com. If you wish to attend my free training called Discover the Secret to Boosting Cellular Regeneration, Reversing Tough Disease and Restoring Lasting Health in your patients with the power of electricity, click the registration link near this video. I'll see you next time.